to counsel families or just to help them have more knowledge or information about sickle cell disease to prevent these discrepancies and conflicts in families? Because as you can see, it has broken a marriage. What can be done?
Yeah, that's a very good question. And actually, listening to her, I can empathize what's going on in the families. But I think there's need for the government and essentially the medical community to educate the community that this is a treatable disease. Most of these crises that we talked about when you have a kid with sickle cell, it's a very painful disease, and it is treatable. As a researcher, as a scientist, there is a very, very basic, simple treatment for this disease. It doesn't have to be like that.
Okay.
So I think what the community or the government can do is make sure the parents and the community know this disease is treatable. It's very important for the parents to be educated that this disease is not like malaria, whereby you take medication for 1 week, you get well. This is a chronic disease. So as long as a parent knows my kid has sickle cell anemia, they will have to be on treatment as far as they live.
Yes.
But we have other treatment options when we talked about bone marrow transplant for gene therapy.
Yes.
Those are now when you are talking about cures. So I think the greatest thing, and I think that is what we have discussed, we talked about Kisumu when we started a partnership between our pharmaceutical company and the county, and this I think should happen all over the country, is to make sure that medication is affordable and accessible. Those are two different things. So as a company, what we have decided to do is to make this medication not only affordable, but affordable.
Yes.
So is to work with the government, make sure that every child who's suffering from this disease has access to this medication.
Okay.
And this medication must be taken every day. It's a chronic disease. So it's important for the parents to understand that if they were prescribed medication, they shouldn't think that once that medication is being used, the disease goes away.
Yeah.
The disease will always be there until now it comes to these other treatment options for cures.
Bone marrow transplant,
and gene therapy. There are other things that is going on. I'm aware of other medications. Actually, we are discussing with the lead scientist of a new medication where we will start doing clinical trials. So as a company, and what we recognize is that in the United States, the government essentially ensured that this medication, if the parent cannot afford, they get this medication for free.
Okay.
So in our landscape here, as Kenyans who have gone through the system here in Kenya, we have gone through the system in the US, and we want to transform lives, not just treatment. Our mission is to transform lives. So as number one, start with the screening. Number two, make sure the parents have access to this medication. And then after that is when you start looking at these other treatment options because they are very expensive.
Okay. The government, in paper, is supposed to be covering sickle cell disease through the Emergency Chronic and Critical Illness Fund. Jacinta, serikali imekusaidia kununua madawa na kutreat watoto wako ama situation iko vipi kwako?
Hapana, hata ukienda kwa hospitali ya serikali hakuna dawa kama hiyo.
Hakuna dawa.
Tunanunua na pia kila mmoja iko na bei yake. Saa zingine wanakanga hata mwezi mzima wana dawa.
Wana dawa.
Yes, wakiumwa nakimbia na nunua diclofenac wameze. Itulise tu hiyo uchungu. Juu ni ya kununua. Na SHA isaidi.
Okay. Na inakugharimu shilingi ngapi? Kwanza unaweza kuafford wewe kama mama na pia mzee wako mnaweza kuafford hiyo dawa na inawagharimu how much?
Saa zingine siwezi nunua hata ya 1 month. So nanunuanga ya wiki. Saa zingine nanunua moja nimemnunulia kama huyo mkubwa anakaa sana bila kumeza dawa. Naomba tu Mungu. Namwambia kunywa maji mingi. Na ukae na amani na uombe wewe umesha kuwa mkubwa. Juu siwezi nikamanage wawili dawa.
Na unaweza sema inakucost how much ukinunua kwa hiyo ya wiki ya mtoto mkubwa na mdogo for 1 week? Inaweza kucost how much?
Nilinunua ya 1 month ilichukua 1,000. Ya moja ilichukua 1,900, mwingine pia ni hivyo.
So total about 4,000 shillings.
Yes.
Na hiyo ni per month?
Hiyo ilikuwa 1 month.
Na ni dawa moja ama zote?
Zote.
Kuna pain, kuna
zote
kuna
zilikuwa tofauti.
Kuna hiyo hydroxyurea.
Na unajua hiyo si eti nilinunua yote kwa chemistry. Hiyo nilipelekwa hospitali, kuna zingine nilipewa bure. Kuna hapa inaitwa Germany hapa Madare, kuna yenye wanatupea bure na kuna ya kununua. So ya kununua ndio nilinunua hiyo bei, ya bure nilipewa. Na hizo za bure nikinunua pia ni bei kali. Natumana nyumbani. Nyumbani afadhali nyumbani wanauza moja 15 bob. So natumana na nawekewa kwa mzigo ikuje kama partial. Lakini hapa sijaisi mama kama sina pesa ya kutuma nyumbani wanakaa. Yes.
Pole sana. Na wakati ambapo inabidi wakuwe admitted, kwa sababu umemention kuna wakati wana have kufanyiwa blood transfusion. Huo unafanya aje? Unatoa wapi pesa?
Naomba. Naomba. Bora tu najua mtu ni rafiki yangu. Naomba.
Na inaweza kucost how much for admission na blood transfusion?
Inalingana amekaa siku ngapi. Kama huyo mkubwa alikaa karibu 1 week. Hata siwezi imagine pesa ngapi nilitumia. Siwezi nikakumbuka.
Ukumbuki?
Yes.
Pole sana. And Dr. Charles, let's talk about now the gaps in Kenya compared to the US. I know you've worked in both countries. What needs to be done in Kenya to ensure that sickle cell disease treatment is available?
I think first I'll start by applauding what Kenya has done. And the first thing Kenya has done, Kenya has a very detailed national guidelines for sickle cell disease. So what I would say now is implementation. So the major gap that we are trying to address is newborn screening. And the partnership program that we have created in Kisumu County is to address some of these issues. And I do applaud and commemorate the governor of Kisumu to take this initiative, whereby he set up the first comprehensive sickle cell disease management center. And the center will cover all the aspects that we think will be able to address the main issues we're seeing. So that is one. So the government has to provide. And I like what the mother said is, what is SHA giving to sickle cell patients? And I think it's a high time SHA increases the coverage. And why do I say this? It's because these children begin treatment from 9 months for the rest of their life. So we are not talking of one. Kenya statistics show we could have close to about 40,000-50,000 patients. Those are the ones we know. They could even be as high as 100,000. So this is a task that especially parents cannot be able to cover. So the government has to increase the current. And as I said, current for the ever first time, sickle cell disease is being covered by SHA. What we need to ask is the government to increase the coverage of patients with sickle cell disease that can cover from newborn screening to treatment. And also the multiple admissions. These children, if they are not treated early, they will be in the hospital all the time.
For sure.
And the other thing, as my colleague stated, is accessibility of this medication. They will have the medicine today. The mother can afford medication today. Tomorrow they cannot. This is not a drug that you take today and don't take tomorrow. So we are seeing parents today they can afford, tomorrow they cannot. And unfortunate, these patients are children. They depend on a caregiver who's a mother. If the mother cannot afford, this child has no treatment. So we really have to look at especially at the government level, to look at a comprehensive way of how to take care of sickle cell patients.
All right. And Dr. Wycliffe, I know you talked about what Unigen is doing with the government. Please tell us specifically, what are the steps you're taking in this partnership to ensure that the treatment is available?
Yeah, one, and I want to add on what my colleagues, Dr. Tieno has said, is we have had these ongoing discussions, and we actually invited the Prime Secretary to our site in West Virginia, and actually we had time to discuss what can we do to contribute to this effort of addressing sickle cell anemia in Kenya. So, one, we have gotten a lot of support to have the medication approved. Already our medication is going through registration here in Kenya, and as soon as the registration is complete, we will make it very affordable and make sure that we are supplying Kenya to have that medication, and we want every child to be on that medication.
Okay.
But also, as I said, patients respond differently to a given medication. So we need to have another treatment option which is affordable. Now that comes to the second medication, which we are planning to start registration here in Kenya, such that when the parents are using this one medication, hydroxyurea, the kids are not responding, or they're having side effects associated with this medication, they can switch to this other medication.
Okay.
So Unigen really is to make sure that we are supporting the government, bringing in the highest quality medication, affordable, and it is to be accessible. And as I mentioned, in Africa, we don't have a pediatric formulation for sickle cell medication.
All right. I'd like to continue with the conversation, but unfortunately our time is up. And thank you so much for joining us. Let's just now wrap it up. What is there any hope? What are the options? There's this gene therapy, and there's also bone marrow transplant. Dr. Charles, how viable are those treatments? And then as we wrap up, just 5 seconds each. My director is screaming on my ear that we have 10 seconds left. Just give hope to someone at home who is struggling with this disease. We'll start with Dr. Charles with the gene therapy, and then Dr. Wycliffe with hope, and Jacinta utamalizia utuambie wewe umemanage aje na mtu pale nyumbani anaweza manage aje na sickle cell disease.
So the hope is that the world has made a lot of advances in sickle cell management. There's gene therapy, there's bone marrow transplant. But what we need in Africa is to give this child this simple drug called hydroxyurea. Because as we said, gene therapy in the US is $1 million treatment per patient. Bone marrow is almost 500,000. The cost of hydroxyurea, if we are to access to our patients, we can give it at even 10 cents.
Thank you. Dr. Wycliffe?
Yeah, what I can advise the parents right now, stop thinking about gene therapy, stop thinking about cures, get the cheapest medication for treatment of the symptoms, keep the kids alive, keep them comfortable before you move to the next stage.
Thank you. Tukimalizia na Jacinta.
Yeah, na itamwambia
Mzazi yoyote ama wasasi wale wako na watoto kama wangu wakwae na hope, watoto hawatakufa, watoto watakuwa salama, wape watoto maji, kienyeji na fruit.
Thank you so much for tuning in. That's how we wrap it up. 1 hour can be such a short time, but remember, sickle cell disease is not a death sentence. There's hope, it is manageable, and it is treatable. My name is Chabet Birir. Have yourself a lovely evening. See you again next week.